hygiene. Yes, especially when it comes now to the consumption of the food of animal origin.
Okay. Yeah. So people know that you should not take unpasteurized milk, or if you're getting your milk from the cow, you have to boil it and all that. And that is common knowledge for most people who have even little education. Yeah. So apart from, you talked about vaccination, you talked about public awareness, and also the fact that the government will ensure that they have the vaccines in case somebody gets bitten. Maybe, for example, they use the example of rabies. Maybe like for vector-borne disease, for example, like mosquitoes, you can be able to clear the area and do what. Are there anything someone can do to the environment? Like maybe somebody who's keeping poultry, somebody who's keeping cattle, that can, at least the environment can protect those animals from getting this kind of infections?
Yes, there is something we call biosecurity. And biosecurity is whereby you put some measures, some control measures. The statement we normally use is, say, you keep the disease away. It's like you're telling the disease, don't come here.
Yeah, exactly.
You just keep
Prevention
the disease
better
away.
than cure.
So when you talk of biosecurity, is where you work with the issue of having the houses that host the animals being disinfected, doing routine disinfection or fumigation, just to kill the viruses and the bacteria. Again, the way the houses are constructed, they can be constructed in a certain way. Probably sometimes we shield the houses from, the direct wind, because some viruses come through the wind, being carried by the wind. So the location of the houses, the animal density, the population density, Then another thing that people always forget, and this is a very big mistake, is where they allow every person from wherever somebody has come in, just to come and visit the houses. Somebody from the market comes to see the animals. I don't know, there's an animal show, people are coming to your place to see your animal, those kind of things. So the interaction of people with the animals.
So do humans also infect animals?
Sometimes we also act as the intermediate host.
Intermediate host.
Yes. So the virus is coming from this, coming to us, and then it can go back to the animal. And then by the time you are getting it, is now in the severe stage. It is now in the infective stage. So that interaction is also not good, because it is making the life cycle of the causative agent to be complete. So that close interaction with animals should be avoided. Like now, there are farmers I work with, like the farmers who do pigs, especially for farmers' choice. They are very strict. You don't just get into their farm anyhowly. They restrict the number of people that are supposed to get into that house at any given time, because they know you have visited this farm, you have visited another farm, you could be carrying this virus, another one could be carrying this virus. By the end of the day, these animals just get sick. And again, you don't know what kind of virus you are dealing with. So if it was a zoonotic problem, then if it was in Kiambu, then by the end of the day, it will be in Nairobi, it will be in Murang'a. That is the
especially if it's one veterinarian moving from one area to another. And I also see them putting, I don't know what they're called, but like a small pond of water where somebody will put in their gumboots as they go to see the animals. That's what we call the foot bath. It is part of the biosecurity. So that foot bath, it has been, it is just a disinfectant that has been put in the place, a disinfectant that has a residual effect that will take some time. So anyone who comes, because the feet are the ones stepping everywhere. So when you are coming in, you have to dip your feet there, you have to dip your shoes there or your gumboots before you enter into the house. So we believe if there are some viruses or bacteria that you are carrying, then at least they will be killed by the disinfectant. So as you are getting to the animal house, you will be safe. And also as you come out, because you may have picked the viruses now from the animals, then as you come out, you are supposed to be free. So it's put at the entrance and also at the exit. And also another thing, you will even find even in our laboratories, maybe the vet laboratories, or even in our headquarters, at the main gate, they always do a very big foot bath, even because of the vehicles. Because as the vehicles come in, they could be carrying the viruses, and the area is a bit protected, so that you don't end up, bringing a lot of cross infection. That's interesting.
So that one is very important.
Yeah. Okay. So as you said, the list is quite long.
Yes, it is.
And I would like us to touch on a few of these infections. Yeah. So I think we can start with rabies, because rabies is quite common. We have many people who like dogs, and they're keeping them either for security reasons, and others are keeping them maybe investigations, you know, like the policemen and all that. So what is rabies, and how is it transmitted to people?
Okay. Rabies is a viral infection caused by the virus in the family. You know the way we classify the viruses. We have the genus, we have the family, we have the order. But now it comes from a genus family called Lysavirus. So the virus itself is called Lysavirus. So it's a virus that is very dangerous, very virulent, very pathogenic, as in it cannot miss. Once it attacks, the symptoms have to appear, the disease has to occur. And this rabies virus, why is it dangerous? It's because it affects the central nervous system. That's the dangerous part of it. And in case there is no intervention, especially for people, then death is the ultimate thing. So in animals, rabies affects basically almost all mammals, but the major animals, one of the major host is the dog, or anything that is in dog's family or the feline family. We call them ferals.
The feline, you mean like
the feline? We
lions.
talk of cats and the line of cats, you know, the lion, the cheetah, and all those things. Then we have, now when you talk of dogs, we have the fox,
jackals,
we have the skunks, you know, those kind of things. The monkeys.
Monkeys?
And yes.
Monkeys are in that line.
No, they are not in the line of dog, but I'm saying the rabies will affect basically
even monkeys.
Even monkeys, they get the rabies.
They get the rabies.
Then in our domestic animals, now we have the dogs, we have the cats, we have the donkeys, the camels, and also sheep, goats, and the cattle.
But the main transmitter is the dog.
Is the dog.
Okay.
And most of the time, we say the dog, we normally call it the definitive host, the one that has them, you know, like the last stage of the virus. So the dog is the main one, and the wild fox. Those are the and something we call raccoons. Okay, I don't know the raccoons. I don't know how they look like.
I know they have black eyes.
Yes, those ones.
Yeah.
So those are the major hosts of the virus. So what happens if a dog happens to be bitten, probably by a wild fox or something, or another dog that has already contracted the rabies virus? One of the symptoms that you note in your dog, the dog will just become restless. Basically, the rabies comes in two forms. There is what we call the aggressive form, and we also have what we call the dumb form. The aggressive form is where
dumb, like somebody who can't talk.
Yes. The aggressive form is where the dog becomes very aggressive. A dog that was just calm, all of a sudden it starts biting people. It will bite a child, it will bite the owner
without even being agitated by anything.
Yes, anyhowly. And then it will be so restless, so aggressive, so alert to any kind of noise, alert to any kind of light. You know, they kind of get frightened with the light. And then they salivate a lot. They really drool a lot of saliva. And you know, by this drooling of saliva, actually the saliva is normally full of a lot of viruses. And that's why when you have a bite, as long as you have come into contact with that saliva is full of the virus. It is one of the, you know, the transmitter, carrier of the virus itself. So those are some of the signs that you normally check.
This dog is
and then
infected.
Also another thing, one of the what we call pathognomonic sign, you know, the one that you see and you say, and surely you know, this dog,
static.
Yes, they normally become hydrophobic.
They are scared of water.
They are scared of water. You try to give that dog water. The moment it sees water like this, you know, kind of they have seen death.
Okay.
You know, they cannot drink and they have a difficulty swallowing.
They choke.
Then, yes. And they also change the, you know, the sound. The vocal cords are affected and therefore they are not able to bark in the normal way.
It looks like the symptoms in the dog are exactly the ones in the human beings, because even human beings get photophobic. They don't want to see light. They don't want to see water. You give them water, they start choking. And even the aerophobic, like if you fan them, they seem to start choking again.
The fear of the wind.
The fear of the wind.
Yes.
Okay.
Or anything that is the moving air.
So
those are some of the signs we see in the dogs.
I think we're going to stop there and then we'll continue. We want to go on a break.
Nice.
So guys, I hope you're not getting scared by all these things, but if you love pets, you're encouraged to vaccinate your pets and make sure that they're safe for everyone around. So we are trying to teach you what it means to have zoonotic diseases. Kindly don't change that dial. As we see, we're going to come back in a short while. Thank you. Keep it on Health Up.
Failure to perceive and interpret failing well can make you a failure. Wow. Staying in that place where you failed and building a house of mourning about your failure.
A house of mourning, so you say?
Yes, makes you a failure. When you tag yourself a failure because of what has happened, you become a failure. When you allow other people to tag you a failure because of what happened to you or an event of a failure and you take it as you become a failure.
So his wife and little boy both died in the crash?
The city of Raymond is dying. I have a plan to turn things around, to open up a hotel casino.
But gambling is illegal.
Not for much longer.
Mortgage is $500,000, and they're in foreclosure as we speak.
The bank has sold our church to a group of investors, and I'm sad to say that they will be moving us out next week.
Look, I don't hire strangers. Never have, never will.
Look, I'm just looking for an opportunity to prove myself.
You've become a problem.
Well, things are really tough in this town right now.
I thought that's when people needed the Lord the most, when times were tough.
If Jesus was the editor, do you think he'd print this?
But I also know in my heart that this is what Jesus would have done.
They stopped saying prayers in school yesterday.
When you find yourself struggling with life's difficult decisions, ask yourself one simple question.
Missions overflowing in the crowd.
What would Jesus do?
I'm not sure, but God, I wish I knew. What would Jesus do? What would Jesus do?
Welcome back, guys. Keep it Elevate TV. We love watching Elevate TV. Personally, I love watching Elevate TV and I love the shows that are there, Health Up being one of them. As I am doing this, today we are talking about zoonotic diseases, and we say these are diseases that come from animals or pets to cross-infection to the human beings. And we are joined by Dr. Margaret, Nyoike. She's a veterinarian or a veterinary surgeon, and she's doing a good job. We are talking about rabies. So we're going to take it from there. My name is Dr. Sylvia Mwathi, and I am your host. So Doc, let's continue. You were telling us some of the symptoms of rabies.
Yeah, we're just talking about the symptoms that you find in a dog.
Yeah.
These are the same symptoms you are going to find in another animal, especially donkeys. Rabies in donkeys is very common. Like recently I encountered one.
And even the donkey.
And even the cattle, the sheep and the goats. Actually, recently we killed a goat so that we can, once we identify an animal or we suspect an animal has rabies, the rule is you are supposed to kill that animal, then cut the head, then we take the head to the headquarters, our lab, our central lab.
So that's what we call euthanasia. Before you start saying you're killing.
Oh, by the way, this is what we call it humane killing. You don't just slaughter, you just kill humanely. For the donkeys, you cannot just kill. We normally get these people who deal with the donkeys. They are called KENDAT, or Kenya Society for Animal Protection. Those ones, they come and use a gun. There's something that they normally use to shoot because you cannot even be able to approach the donkey. So for the donkeys, again, they'll be aggressive. They'll be biting themselves. They'll bite the owner. They'll bite everything. They'll bite other donkeys. The same case with the cows.
So the donkeys don't end up kicking people. They also still end up biting.
They will bite.
Okay.
Actually, they will charge. The moment it sees you, it will charge and they bite. And the worst is that they also bite themselves. So those people who have donkeys, if you see an animal, that even the cows, if you see a cow trying to bite itself, trying to bite the udder, trying to bite, like this area we call the flank, the stomach.
Flanks,
Just know you are dealing with an animal that could be rabid, and you should be very careful in handling that animal. Always call a vet or even report to, even if it's a police, just report to an official, because we call this disease notifiable. So you have to notify the authority.
Can I just ask something there? Because you said it's biting itself, and the saliva is very, very much the mode of transmission. What happens if that saliva comes to the mucous membranes, or if it comes to contact with maybe an abrasion or a wound?
Yes. That's another thing. So when you talk of now transmission to people, it is when you are bitten by the animal or you have an abrasion or a skin cut and it comes into contact with the saliva that is already loaded with the virus. That is how people get affected. That is how people get the rabies itself.
From the animals.
Even for a cat, a cat may not bite, but it will scratch. If that cat was rabid,
from the scratch.
Yeah, from the scratch. And probably as you are handling the cat, probably you come into contact with the saliva or any fluid that is coming from the cat. You end up getting the rabies. So for the human, once you get the rabies, again, if you are not treated, the signs that we saw in the animals, especially the ones that we saw in the dogs, these are the signs, and you are a doctor, probably you've known of those signs, because it will just affect it just affects the central nervous system, affecting the brain, targeting the brain and the spinal cord.
Actually, let's say if it bites, for example, the hand, it will use, then the virus will move through the veins, from one synapse to another until it reaches the brain and the spinal cord, and then starts coming back anterograde. Okay.
And actually, the more the bite is closer to the head, the more the symptoms will appear very fast.
The earlier the
symptoms will appear. So at times they may take like a week, 1 to 2 weeks, and at times they may take 1 to 3 months. So when the symptoms are there, the symptoms of somebody who is suffering from a central nervous system problem. So the convulsions, the seizures, and it starts by having some fever and what we call a tingling sensation at the bite wound. That tingling thing.
Then irritation in that area.
Irritation. Then, as you said, you become hydrophobic, photophobic. Any kind of sound irritates you. And then the issue of the vocal cords being affected, and then you are not even able to swallow very well. So for the human, the moment you know that you have been bitten by a dog, or you are aware that somebody has been bitten by a dog, we always say, if you don't know the history of that dog, you always assume it can be rabid. So you are supposed to seek medical intervention within 24 hours. Because within 24 hours, for human, you are normally given a post-exposure anti-rabies vaccine, which is it is human diploid cell. That is the kind of vaccine, you know, not the one that is derived from the animal breed. Yeah, now this one has been made specifically for the human use. So we cannot use the vaccine we normally use for the dogs. So you're supposed to seek medical intervention. You're supposed to be given the post-exposure vaccine, and then it's a series. You get like 3 to 5 shots at a certain duration.
Day 0, day 3, day 7, day 21.
Yes.
4 doses,
That is the thing. For the people like us who handle the animals, or those who are in constant contact with the animals, you can have a pre-exposure vaccine. There's one that you can be done that can be protecting you for once a year. There's another one that you can do that can protect you for 3 years, for 5 years.
Okay.
Yeah, those are and so when you have done
so
the
that's
pre-exposure,
for animal handlers,
for the animal
those
handlers,
who are,
yes, actually
even
it is for the
farmers who
animal
want
handlers.
to be given,
yes, or those people who know they are at risk, they can be given that vaccine for them to be protected, so that now in case you are bitten by a dog and you suspect, and I mean a rabid animal, and you suspect that it could be rabid, if you had the pre-exposure, then you don't need to go for all the shots. At least you'll be given either 2 or 3, you know.
So less shots.
Yeah, less shots compared to somebody who was never vaccinated before.
Yeah.
So what do we do to protect people from this?
No, but if somebody gets a bite, maybe what I can add. So someone has been bitten, they need also to clean up that area.
You have to clean the area thoroughly, immediately, with a lot of water and soap.
Disinfection.
Yes.
So if they don't have disinfectant, they start with water and soap.
Water and soap is enough.
But a lot of water in that, so that you reduce the concentration of the viruses within that area. Then they can cover the wound or not cover the wound.
They're not supposed to cover the wound.
They're not supposed to cover the wound.
You're not supposed to cover any bite from an animal. You're not supposed to dress that wound.
The reason being?
You just dress the wound. Just wash, clean the wound, but you don't put any covering.
Okay.
Yeah. And again, I wanted to say, I just wanted to give an example of the coronavirus. You know, the way we are being told, it is covered with a lipid layer. So when you do a lot of soap,
enveloped viruses.
Yes. So even the rabies virus is also enveloped that lipid. So if you are using a lot of soap, basically you will be reducing the concentration of the virus.
Yeah. So guys, what we are saying is that this virus has a lipid covering or a fat soluble covering, which doesn't like water. You know, the way when you're washing a sufuria full of grease, you need to use soap. So again, if you wash that area with soap, you'll get rid of that. You will kill those viruses.
Yes, you reduce. But again, you have to seek medical
intervention. And then seek medical advice, get your vaccines and all that. Yeah.
So what the government has done, knowing that rabies is among the top 5 priority zoonotic diseases, we always advocate for vaccination of the animals. Actually, like dogs are supposed to be vaccinated yearly. Yeah, that is what we encourage. The vaccines are there because this is the only way now we can be able to protect people. And even as we vaccinate the dogs, we also vaccinate the other animals because, you know, the dogs, people are keeping dogs at the same time they have other animals. So we don't just vaccinate the dogs, also vaccinate the other animals, because the animal could be bitten by another dog from somewhere, or a wild fox from somewhere, especially for those animals that go to graze. So the issue of routine vaccination against rabies, that one is there, and the government has always looked ahead and at a time where we are going to eliminate the human rabies in this country
altogether. Okay, that's wonderful. Wow, I think I'm liking this discussion, and I'm also learning a lot. So I think for rabies, we may not be able to cover everything, but what you've covered, I think, is good for our audience. So another thing we can talk about today is cysticercosis. I think we were with you, we're in the same chama. So we were with you when our friends were asking, how does somebody get a tapeworm that causes a cyst to go to the brain? And they were wondering, so we said we're going to do this show to help out our friends. So we can talk about cysticercosis.
So cysticercosis, this is when we say, this is the cysticercosis itself, it's coming from the word cystosarci. This is a larval stage for the tapeworm that is normally lodged in the muscles of the animals. But the adult worm is the tapeworm. So, and here, when you are talking of the zoonosis, you are dealing with the 2 types of tapeworms. There's a tapeworm we call in scientific.
Taenia solium.
Yeah, Taenia solium.
Yes.
This is the pork tapeworm, and then we have the Taenia saginata. This is the beef tapeworm. So these are the tapeworms you are dealing with. And these are the ones that result into cysticercosis. So how does this thing come about? So there's a life cycle. So what happens when the human is the definitive host. When you talk of definitive host, you are like the end person where who is going to be having the mature tapeworm. The mature tapeworms, they reside in us, in the humans, in the intestines, and they mature, and then they start laying a lot of eggs. So the tapeworms, just like a tape, they normally have some segments we call proglottids. So these proglottids, once they are so full of eggs, we call them gravid. They are full of eggs, and that one that is full of eggs.
We call a pregnant woman gravid.
Gravid.
Okay, so let's say the tapeworm is pregnant with eggs.
So this one, the gravid, the gravid segment is what is going to be passed by the human through the feces. It will be passed out to the environment. So if the human feces that are full of that have that segment that is gravid, or the segment that has a lot of eggs comes into contamination with the vegetation, then those eggs are going to to contaminate the vegetation. Then we'll have the pork, we'll have the pigs and even the cows coming around and feeding from the vegetation. They are going to pick the eggs. So once the eggs get into the GIT, the digestive system of both the cow and the pigs, they hatch in the intestines. They hatch into something we call oncospheres. That's just a stage. Then now these oncospheres, they develop, they move through the intestinal wall into the bloodstream, and then they start lodging into various places like the liver, the muscles, and where they lodge, that is the stage you are calling cysticerci. That's now the next stage. That is the stage. It is like the larval stage before now you go to the mature
stage.
So now,
so you're saying they cannot mature within the
they cannot mature within the cow or the pig.
They can't mature within the pig because it's an intermediate host. They need now the human being who is the definitive host to complete the cycle into a mature tapeworm. Okay.
So what happens for the meat inspectors? At the slaughterhouses, we normally have people who have been trained. Okay, I'm also a vet, but now you have to be trained as a meat inspector. So when you do meat inspection, those are some of the things you normally check. You cut the muscles to see whether you are going to get those cysticerci, because any meat that is found with those cysticerci is supposed to be condemned. It is not supposed to be consumed by the human. And that's
are they large enough to be seen, or you need a microscope?
Yeah, it's just you don't even need a microscope. Sometimes it is like a larva that has been surrounded with some fluid, so it forms kind of a cyst. So some of them you can be able to see it, especially for the beef. We normally concentrate on these muscles, the submandibular muscles, and also the tongue. The same case with the...
Also, there are those specific areas where you think you might find
where
them.
You have a lot of muscles. So there are those areas we normally check. So that is how we, the humans are protected, because once this meat has been inspected, it is condemned. It cannot go into the market.
And in this Kenyan market with corruption,
now that is the problem. And also people slaughtering their animals, slaughtering animals in their homes, or in the local butchery without them being inspected. So now, basically, when that life cycle is like that, where the human only harbors the mature tapeworms, you end up having the usual discomfort, the diarrhea, that one, and most of the time, if the person is having the tapeworm, you may not even have a lot of symptoms. You could be asymptomatic. But if the tapeworms are a match, because remember those tapeworms are so long, like the Taenia saginata can be up to 25 meters, and the solium can be up to 7 meters. So you can imagine.
It's coiled in the intestines.
So basically, that one is not a very big issue.
Diarrhea, loss of appetite.
But now, something else can happen. Instead of the human being the definitive host, he can become the intermediate host.
Okay, so let's just complete. So for the human to get infected with cysticerci, for it to complete the whole cycle, the human will take undercooked meat. which has the cystic which now the larvae goes into the stomach or into the intestines, and then now it matures into the tapeworm.
That is the thing.
That's how the cycle is complete.
That is how the cycle is complete.
But now for cysticercosis, it's a whole different story.
It's a different story. So here we are saying the meat is not cooked well, so you have taken the cysticerci when it is still alive, you know, kind of, and it will go and mature and complete the cycle. The cycle, and there you act as the definitive host. You will be harboring the mature tapeworms. But now it may happen, a process may happen whereby now the human becomes the intermediate host. Now having instead of harboring the mature tapeworm only, you have now the hatching, the oncospheres hatching in the human. Instead of now hatching in the animal, they end up hatching, so the human will have ingested the eggs. How does this happen? This happens when, because of lack of proper hygiene, probably where the feces were, there is contamination, and the human ends up taking food that has been contaminated with the eggs. And remember, these eggs
came from passed in the stool.
Yes.
With the gravid.
Yes. And these feces are coming from the human. So it's kind of, you are taking food that is already contaminated with human feces, the human feces that already have the eggs. So the human will end up now taking the eggs. The other time they was taking the cysticerci, the meat that has the
meat that is not condemned. It was supposed to have been condemned, but wasn't condemned.
And now you have taken it. So this time round, you are ingesting the eggs. So now the eggs will hatch in the small intestines. And the process will continue like what happens in the animals. So now the oncospheres the eggs are going to hatch into oncospheres, then the oncospheres will pass through the intestinal wall, then to go and go through the bloodstream, then look for the lodging places. And where does this thing lodge? In the muscles, and even in some, essential organs, the liver, But the worst part of it is when it lodges in the brain. And the same process, it will go, it's a larval stage, which you are calling the cysticerci, which will go and it will be surrounded with a fluid. It becomes the cysticerci. So this is now how the human get the cysticercosis. Because this cysticerci will go lodge in the brain, and sometimes even in the eyes. And so they will end up having a neurocysticercosis.
Okay. Yes. So let me just bring this clear so that the audience can understand. Because I think that day people were saying they're scared of taking
the pork meat.
So we're saying somebody is not getting neurocysticercosis or the cysts into the brain from eating the undercooked pork. What they get from eating undercooked pork will just be the tapeworm. But if they eat the eggs, which are coming from the feces, which are contaminated with the eggs, then that is what is going to cause the cysticercosis. So we're not telling people that pork is bad.
Pork is not bad.
Pork is not bad. It's eating the eggs of these tapeworms that is wrong.
And the thing is, it's not, pork is not bad, but it should be cooked properly. Because remember, for this whole process to be there, so if they took the pork that had the cysticerci, then end up with the tapeworms, then shed the eggs, probably you may end up now contaminating yourself with the same eggs that came. So the human is very important.
So without a human, you cannot complete this cycle. That's what we are saying. The pig itself cannot complete the cycle on its own. Okay,
that is the thing.
Awesome.
So the very important thing, meat should be cooked properly. Because as long as there is any contamination, the cycle can change. And remember, it is not just about the human consuming the food that has been contaminated with the eggs. Sometimes in our system, we have what we call, we can have an autoinfection whereby the eggs, the gravid segment in the small intestines, the eggs can be shed there. And then they go back to the blood system
through
what we call the reverse peristalsis.
Instead of what you call
auto-infection. So instead of the eggs going out, kind of they are going back to the intestines, going back to the process, and then they'll mature, they will start penetrating through the intestinal wall, get to the bloodstream. So this one, you have not picked the eggs from the environment, they are just within the system, but they have gone back to the starting point.
So the main thing is cook the meat properly, whether it is the pork, whether it is the beef, it has to be cooked properly. So the other thing is just to say what are some of the symptoms that are there, like for the infected human.
Okay.
Yeah.
So now what happens once you get this cyst sarcosis, it will affect the brain. So this thing will just go and lodge somewhere, and you know the brain is very sensitive, so it will be occupying some space. So what you end up getting, you will have a lot of intracranial pressure.
That's especially in the skull.
Yeah, you may end up having, you may see somebody having some seizures, some convulsions, you know, anything that is associated with the central nervous system. And if it gets into the eye, again, you may end up having, you know, an ocular problem because of the cyst also occupying some space and causing the eye kind of to bulge.
Yeah. Or but visual acuity, maybe blurring or vision, not seeing well.
But the worst part of it is when it is in the brain, and you know it will keep on growing.
Yes. And also in the brain, it can cause what we call hydrocephalus, when it's blocking this cerebral spinal fluid from flowing from the brain down to the spinal cord, especially in children.
Yes.
That's something that can happen.
And then because of that, you may end up having, you know, blindness. You know, I talked of the convulsions, the seizures, the issue of, you know, paralysis to some extent. If this thing continues growing and it becomes chronic.
So and management, because I can see our time is, we have 5 minutes, so we need to do our parting shots. And at least maybe talk about how we manage the cystic sarcosis.
So for the management, basically we said proper hygiene for the people. Please let people use latrines, because we know in those remote places where we don't have pit latrines, you know, you end up having a lot of contamination with the human feces. So it is very good for people to use pit latrines for them to relieve themselves. Beef and pork should be cooked thoroughly. Then animals need to be should be dewormed regularly, and also human beings need to get dewormed regularly. So in case somebody has now the tapeworm, some deworming can be given, the albendazole, the praziquantel. But now when it comes to cystic sarcosis, you know, the diagnosis will need something like an MRI or the CT scan. If it is identified, now that's another different thing. Now in the medical field.
Okay, so in the medical field, basically, I think if it's causing hydrocephalus, they'll do the VP shunting, but they put a pipe from the brain to the abdominal region to drain the fluid. Then they'll still give the albendazole and anti-inflammatory medication, so that you just prevent that from keeping on growing. And if they have seizures, you give them anti-seizure medication, so they don't have a lot of epilepsy, because they can get recurrent epilepsy from that lesion in the brain. So I think we are good. We may not be able to touch on something else. We want to talk about brucella, but that means Dr. Margaret has to come again. So Dr. Margaret, thank you so much for covering with us the topics. We've learned a lot and we are grateful. So for cystic sarcosis is a parasite, for rabies is a virus, which you can get, somebody can be vaccinated and the animals can be vaccinated. So even as we end our show, kindly just look into that camera and give us your parting shot.
Oh, thank you, people. So animals are very important because they give us food, they give us milk, meat, and all those kind of things. And some of them also give us companion. But even as we interact with them, we have to be very careful. We have to listen to the authorities, the vets, what they are advising us. Let's protect the animals from diseases. And by doing that, we'll be protecting ourselves from getting the diseases. God bless you.
Yes, thank you so much. Thank you so much. So guys, that's what we had for you for today. If there were difficult words, because I know she's really a medic, she used a lot of jargon, kindly just have your Wikipedia with you to keep on checking. But you'll be tuned in even next week on Wednesday. Our show always comes between 6 and 7 p.m. and keep it Elevate TV. Till next time, I was your host, Dr. Sylvia Mwathi. Thank you so much for keeping it health up.
Today's pastor is not evangelizing, yet he needs to evangelize.
Never outgrow soul winning. Never.
Never.
I tell you what, if I sit with you in the plane next to you, going to Europe, going to America, 8 hours, by the time we land, either you are on your knees or your tears are coming out. I will not forgive you to sit next to me and go to America as a sinner or go to another country as a sinner.
No.
You, pastor, you are rising up. You, man of God, you are rising up. But this is a time to sharpen our weapons. And we will tell the generation to come that we went through tough time, but God saw us through. A righteous man falls 7 times, but he rises up.